Hello and welcome to your video lecture on section 13.4, where we are going to talk about the peripheral nervous system. Starting off with our ganglia. Whenever you see this ball-like structure within our peripheral nervous system, we are going to call this a ganglion for singular and ganglia for plural. This contains a group of neuron cell bodies within our peripheral nervous system, and it could be sensory, or we have something called an autonomic ganglia, which we'll talk about more next week. We also see here, this specific one is going to be called our dorsal or posterior root ganglion. This, as we said, will be a collection of cell bodies of neurons with axons that are going to have sensory endings in the periphery, such as our skin, and can extend into our central nervous system through the dorsal nerve root, which is pictured right along in here. And these are going to be unipolar cells. So what I mean by that is that we will have, let me see if this pen is going to work. We'll have that neuron bringing information in. We will have an extension here to our dorsal horn, but the cell body will extend on out over here. So this is the cell body within our ganglion. All right, let's get rid of that. And in this view, we can also see a histology image of what that looks like. So here are the axons, whereas over here we can see the cell bodies. So our autonomic ganglia, I said we're going to talk about this more next week, but just as a quick little run through, our autonomic ganglia are going to come from our sympathetic nervous system. So we can also call this our sympathetic chain ganglia. Here is our spinal cord. So all of the sympathetic motor neurons are going to come from an area called the thoracolumbar system. So we are going to start from T1 and go all the way to L2. And in that, we'll see a short to what we call a preganglionic neuron that will then synapse with our sympathetic chain ganglia. And then you see a second neuron here that we are going to call the postganglionic neuron that will be longer and extend to our actual gland, or it could also be cardiac muscle or smooth muscle that it'll go and control. So where this is coming from in the spinal cord is the area of the lateral horn. And sometimes we have different routes that we can take. So this is more of a direct route that I pointed out. And I keep losing my mouse, so that's why I'm moving it around so much. But here's more of the direct route. We can also use our paravertebral ganglia, which are going to be 3 ganglia within our cervical region. So you could see that pictured along over here. And note how we can also bypass and move up the sympathetic chain. And then we also have our prevertebral ganglia. What that means is that first preganglionic neuron will bypass the autonomic ganglia, the paravertebral ganglia. Usually we're in a different area than the cervical area. So it extends out, and then we have another ganglia that we call a prevertebral ganglia, and there are 3 that are located outside of the chain and found anterior to the vertebral column. That's also why it's called prevertebral, because it's located anterior to it. And then the postganglionic neuron will then take its extension over to the organ we're trying to give supply to. And lastly, we have our terminal ganglia, and that is when we receive input from cranial nerves or sacral spinal nerves, and that is only going to involve our parasympathetic nervous system, which we are going to see over here. Note that we have a very long preganglionic neuron. This is going to be called our vagus nerve, actually, which is a cranial nerve, and that's headed over to the heart to give supply. All right, now let's talk about our nerves, which are axons in bundles. So not only will we have those bundled axons, but we will also have Schwann cells. If you remember our Schwann cells, they are going to wrap around the axon to create myelin sheaths so that impulse can move through faster. Now, our nerves, just like our muscles, are very organized and are going to have connective tissue layers. So first we are going to have our endoneurium. This is going to surround the individual neurons or axons and their Schwann cells. The perineurium is going to surround axon groups to form fascicles. So here's a fascicle, here's a fascicle, here's a fascicle. So it's that darker blue surrounding it is the connective tissue, perineurium. And then we've got our epineurium that is going to surround the entire nerve itself. So it bundles all of those fascicles together. Now we're going to get into our cranial nerves. Whenever we refer to our cranial nerves, we always use Roman numerals 1 through 12 from anterior to posterior, and they all have specific names. So they may have one or more than 3 functions. That's going to fit into categories such as sensory, whether it's special or general, somatic motor, meaning we're going to control skeletal muscles, or parasympathetic, meaning it'll regulate glands, smooth muscles, or cardiac muscle. Most of these cranial nerves are going to have a mixed function, meaning that they could be both motor and sensory, and 2 pairs are going to be purely sensory. So a good way to remember this is using this saying here. Some say marry money, but my brother says big brains matter more. And so the S's in here stand for sensory nerves. So cranial nerve number 1 and 2 are sensory. Cranial nerve 3 and 4 are motor. 5 is both, 6 is motor, 7 is both, 8 is sensory, and so forth. I won't read all of them. But each nerve is going to be identified by a Roman numeral number, as we said, and they have a name. So the way to remember the names, we've got 2 sayings here, although there's a slew of them online. If you Google like mnemonics for cranial nerves, you'll have a bunch pop up. I think Wikipedia or some page like that has 55 different ones you could choose from, but these are the ones that I learned in college. So first one is, on occasion, our trusty truck acts funny, very good vehicle anyhow. Or there's to touch and feel, very good velvet, ah, heaven. So each of those first letters stands for the cranial nerve name. For instance, this first one, O, is for olfactory, second one, O, optic, third one, O, oculomotor, fourth one, T, trochlear, fifth one, trigeminal, and so forth. We're going to go through all of these, so I won't use up our time going through them. This is an inferior view of the brain where we can see each of the cranial nerves. So again, we're going to go through them one by one, so I will bypass this slide. It's more for your own use. So let's get through the first one. Here's cranial nerve number 1, olfactory nerve. What it's going to do is extend out. You can see that it's coming off of the cerebrum itself, and we have the actual olfactory nerves going through the cribriform plate, those little openings. And so what we're going to do is take in our odors. Those chemicals will attach to our mucous membranes here and then be picked up through the olfactory nerves, taken to the olfactory bulb, and the information goes back through the olfactory tract. If we were to somehow have a lesion to this nerve, we would have an inability to smell. Then we have cranial nerve number 2, which is our optic nerve. Here we are going to have the information picked up in the retina through our photoreceptors. That is all sent through the optic nerve. Note how the optic nerve, as we move posteriorly, is going to meet. And what they do is have half of their fibers cross over to the opposite side at an area known as the optic chiasm. Once we have that cross take place, we then have our optic tract. From the optic tract, we don't have this in here, but it'll go over to the thalamus and then send that information to our occipital lobe. So this is for our sensation of vision, and if we have this optic nerve damage, it can cause blindness on the affected side. Cranial nerve number 3 is oculomotor. This nerve is going to exit through an area known as a superior orbital fissure. So you can see that right along in here, and we see it branching to multiple muscles here. So we always say this is like motor to eye muscles or to extrinsic eye muscles. It is going to have parasympathetic fibers within it. So specifically, it'll go to our superior rectus, our medial rectus, the inferior rectus muscle, and also our inferior oblique. We also have it going to the upper eyelid, a muscle known as the levator palpebrae superioris. And then the rest of the muscle fibers are going to go to our sphincter muscles that will be able to control the opening of our pupil, as well as the ciliary muscle for the lens for accommodation. Then we have cranial nerve number 4, also known as our trochlear nerve. This teeny tiny nerve is going to go and supply the superior oblique muscle by passing through the same thing, the superior orbital fissure, as cranial nerve number 3. And so this supply to our superior oblique muscle will give extrinsic motor control there. And then we also have proprioceptive information from that muscle. And if we were to have a lesion here, we'd have a difficulty moving the eye inferiorly and laterally, which is the action of superior oblique, and this can lead to double vision. Now, the big one here, which is the thickest of all the cranial nerves, is cranial nerve number 5, which is the trigeminal nerve. This nerve, as you can see here, is going to extend on down, and it has a ganglion. And after that ganglion, it branches into 3 separate nerves. We have V1, that is our ophthalmic nerve, named because it's going to the eye here. So it is going to give sensory supply to our skin here in the dark brown color. Then the second branch is maxillary, which is V2, so that will exit through the foramen rotundum and will supply this light yellow, or I don't even know what color to call this, khaki, a light khaki color, that region of the face. It'll give sensory supply there. And then down here is going to be V3, also known as the mandibular branch. That is going to give supply to this darker khaki color, darker tan color here. We do see several branches also given off in this area. Remember, you learned about the mental foramen, so an extension of that will be the mental nerve that exits over there. So like I said, we really have sensation of the face here, but there is the specific areas listed for you along in here. Another thing is that trigeminal is going to give innervation to the muscles of mastication, such as masseter, that we would find along in here, and temporalis along in here, and the medial and lateral pterygoid muscles that are going to allow that grinding movement of your teeth. Then we have cranial nerve number 6, which is your abducens nerve. This is going to exit through the superior orbital fissure along with cranial nerve number 3 and 4. And yeah, that's it. And then we're going to have it go and supply just one muscle here, our lateral rectus muscle. So extrinsic eye control, and we also have proprioceptive information from that. And if we were to have a lesion here, it would cause the eye to deviate medially or adduct, causing double vision as well. Then we've got cranial nerve number 7, known as the facial nerve, and this is going to exit through an opening known as the internal auditory meatus or canal, and will branch to give supply to our muscles of facial expression. It is also going to supply the anterior 2/3 of the tongue. We don't really have that illustrated here, but anterior 2/3 of the tongue, we are going to be able to have taste, and we also are going to innervate some of the muscles within the throat and the middle ear. Lastly, we will give parasympathetic innervation to the submandibular and sublingual salivary glands, our lacrimal gland for tears, and the glands within our nasal cavity and palate. Cranial nerve number 8, the vestibulocochlear nerve, that's a long name, right? Vestibulocochlear will exit through the internal auditory canal, and we are going to pull in information that we need for hearing and for balance. So the cochlear nerve, taking information from the cochlea, will deal with hearing, and then the vestibular nerve will take in information from the semicircular canals and the vestibule to give us information about balance. Cranial nerve number 9 is the glossopharyngeal nerve. This exits through the jugular foramen and will go and supply many structures here in the throat area and will give us the sense of taste from the posterior 1/3 of the tongue. We will also supply a lot of these pharyngeal muscles that we see back over here to assist with swallowing, and we supply the parotid salivary gland. And that, of course, will be parasympathetic innervation. And remember, when I say parasympathetic, that's our rest and digest system. So that is going to cause the salivary gland to salivate, right, for digestion. Cranial nerve number 10 is our vagus nerve, and this was called vagus because of the word vagabond, meaning wanderer. This is our longest cranial nerve, so it's kind of wandering all around the body, all the way down to the abdomen. So can you imagine we have a nerve starting at our brain and going down to the abdomen? That's pretty long. So it's going to exit at the jugular foramen as well. And for this, I just want you to know that it's going to give parasympathetic innervation to our pharynx, our larynx, our thorax organs, such as the lungs and the heart, and our abdominal organs. Don't make it too complicated. That's what I want you to know, and we'll keep it at that. So then we've got cranial nerve number 11, which is the accessory nerve. This is going to exit at the jugular foramen, and it also says foramen magnum because it takes quite an interesting path. We're actually going to have its origin come off of the spinal cord, and then it loops up, exits through the jugular foramen, and will then go and supply the sternocleidomastoid muscle and the trapezius muscle. So just those two things. So if we sever this nerve, of course, we won't be able to do the actions that these muscles help us do. Lastly, we've made it to cranial nerve number 12, which is the hypoglossal nerve. This is going to exit through the hypoglossal canal, and that is right above the foramen magnum. And we will see that it'll go and supply muscles of the tongue as well as some muscles within our throat. So that's the main thing I want you to know here. Motor to our intrinsic tongue muscles and extrinsic tongue muscles and throat muscles. You don't have to memorize the individual ones. And that brings us over to our spinal nerves. So the spinal nerves, of course, are connected to our spinal cord. All are combined sensory and motor axons separated into 2 nerve roots. So we've talked a little bit about this before, our dorsal nerve root, which we see back over here. This is all of our sensory axons going through here. And then in our ventral nerve root, we will contain our motor axons. And these would be for both our somatic and autonomic nervous systems. And they are then going to come together here at the mixed spinal nerve. The spinal nerves make up the 31 pairs of spinal nerves. So we remember that as 31 flavors of Baskin-Robbins. And we are going to have 8 in the cervical area, 12 within the thoracic, 5 in the lumbar, and 5 in the sacral. And lastly, 1 pair of the coccygeal spinal nerve. So let's take a look at those branches once again. We had the dorsal nerve root. We could just call this a dorsal root. We've already talked about the dorsal root ganglion here where the cell bodies are. And here we have the ventral nerve root, or just ventral root. Remember, we have motor in here, sensory in here. And where the mixed spinal nerve comes together, it truly is going to mix up these fibers. So once we pass this spinal nerve, we are then going to go out what we call rami. Rami is plural, ramus is singular. So this dorsal ramus or posterior ramus is going to innervate our deep muscles of the trunk, and it's responsible for movement of our vertebral column and the connective tissue and skin near the midline of our back. So typically this ramus is going to be smaller than our ventral ramus or anterior ramus because this is going to be in charge of supplying more things, our anterior torso and all of our limbs. So within the thoracic region, we will form intercostal nerves. You could see that here in the blue highlighted. That would sit within those costal grooves, and it innervates the intercostal muscles and the skin overlaying the thorax. And the remaining spinal nerve ventral rami will form roots of our different plexi within the body. So we'll have five. We have plexuses, but we can call them plexi within the body. A plexus is really an intermingling of the nerves or a network of nerves. I always think of like how a braid gets created, right? We're going to crisscross each other, but they're their own individual strands. And this is just another depiction here where you could see the dorsal root, ventral root coming together to create the spinal nerve, and then we have the dorsal ramus extending back to supply the posterior structures, and here's the ventral root creating that intercostal nerve. So let's revisit the plexi. We said we have 5 of them total. We will have our cervical plexus, that's from C1 to C4. Beyond that, the brachial plexus, which is C5 to T1. Our lumbar plexus is going to be L1 to L4, and then we have our sacral plexus, which is L4 to S4, and then lastly we have our coccygeal plexus, which is really just S4 and S5. So let's start off with the cervical plexus. Like we said, we will find this in the cervical region starting from C1 all the way to C4, and it's going to innervate our superficial neck structure, skin of the neck, and posterior portion of the head. And we have a very special nerve that is given off, and that is going to be, I'm only going to talk about the phrenic nerve, and that comes from C3, 4, and 5. And C5 is going to be shared with our brachial plexus, but this nerve is special because it is going to go down and supply the diaphragm. And then we have our brachial plexus, which comes from C5 all the way down to T1. We are able to take these 5 rami and then convert or intermingle them to create 3 trunks that you see in orange here. We have a upper, middle, and lower trunk. Then we're going to separate it into 6 divisions. We have 3 that are anterior, and then 3 that are posterior back in here. And from there, we are going to create cords. So the cords would be your lateral cord, posterior cord, and medial cord. From there, we are going to have terminal branches. So that would end up with our axillary branch, which you see kicking off to the side here. Then we have your radial nerve, which is going to extend down to go supply posterior structures. We have musculocutaneous, which sits more laterally. In the middle here, we have our median nerve. And lastly, most medial, we have your ulnar nerve. We also have these smaller nerves branching off here, such as pectoral nerves, long thoracic, thoracodorsal, subscapular, and suprascapular. And we are not going to go into all of that detail because there are 16 nerves that come off of the brachial plexus. But I do want you to know that we have 5 roots or 5 ventral rami. And again, it's C5, C6, C7, C8, and T1. And then we will have C5 and C6 come together to create our superior trunk. C7 is going to create our middle trunk, and then C8 and T1 create the inferior trunk. From there, we are going to have all of our posterior divisions of each of those trunks come together to create our posterior cord. We will have the anterior division from the superior trunk and middle trunk come together. And lastly, the anterior division from the inferior trunk will go off on its own. So note how the two anterior from the superior and middle trunk will then create our lateral cord. All of the posterior divisions create the posterior cord, and the one anterior division from the inferior trunk creates our medial cord. From there, we will have, and I just realized my cord color does not match here, but extending from there, we then have the terminal branches. So let's go through each of these terminal branches. First is our axillary nerve, and this was that one that kicked off to the side from the posterior cord, and it supplies only two muscles. We've got teres minor and the deltoid muscle, but it also does supply skin, which you can see right in here, and the joint capsule within the shoulder, which would be right along in here. Then we've got our radial nerve. Not sure what happened with the shifting here, but you could see that our radial nerve does supply a ton of muscles. Essentially, it's going to supply all of the posterior arm and the posterior forearm and a lot of our posterior hand as well. And note that it's also supplying a lot of the posterior skin on the arm, forearm, and hand, and just a little sliver in that anterior view. And here is another view of that radial nerve. Note that it is making its way between two of our three heads of the triceps brachii. So this would be our long head here, and this is going to be our lateral head, and the radial nerve is sitting right on top of the medial head. And just to show you what it does once it gets down to the elbow region, we will see that radial nerve then bifurcate into a deep branch, which is going and supplying this deep muscle of the forearm called the supinator. And we also have a superficial branch that we could find lying deep to this muscle here, which is the brachioradialis muscle. Next up is the musculocutaneous nerve, and this nerve is really going to supply all of the anterior arm muscles, but then what it does once we pass the arm is it changes and will only give cutaneous supply. So that's why it is called musculo in the anterior arm, cutaneous in the lateral forearm, right along in here. And there is the branch coming off of that lateral cord. And here's another view. Musculocutaneous does pierce coracobrachialis muscle about 88% of the time. And then you could see its branches going to biceps brachii and brachialis. And there's its lateral antebrachial cutaneous branch supplying the skin on the lateral forearm. All right, ulnar nerve. This is going to come off of the medial cord. And let's go back here just to show you the root. It does nothing in the arm. Courses behind that groove for the ulnar nerve on the humerus, and then it starts supplying some muscles in the forearm, about 1.5 muscles listed here, and it supplies majority of the hand muscles, anterior hand muscles, I should say. We also see that it supplies about half of the skin on the hand, so it is going to be really that half of that fourth finger and the entire fifth finger right along in here. So we have our muscles listed here. It supplies flexor carpi ulnaris, part of flexor digitorum profundus in the forearm, and most of the intrinsic hand muscles, and our skin in the medial aspect of the hand as we saw illustrated earlier. And here is the route that we see it taking through the arm, again doing nothing, and it's coursing posterior to that groove for the ulnar nerve, which we call the funny bone, striking the funny bone. And here it is deep to the flexor carpi ulnaris muscle, and it's giving off branches to the flexor digitorum profundus muscle and supplying these intrinsic hand muscles. And there is its route going posterior to the medial epicondyle. All right, we've made it to the median nerve. Median nerve also doesn't really do anything in the arm and then continues into the forearm where it's going to supply majority of the anterior forearm muscles and just a few of the intrinsic hand muscles. You can also see it gives cutaneous supply here in the hand, more on the lateral aspect of the anterior view and just really the fingertips in the posterior view. So here it is where we see it coming off of both the medial and lateral cords. And it is made up of a lateral root and a medial root coming from the lateral cord and medial cord. So here's just another view of that median nerve coming through the arm, again, not supplying anything there, and then making its way through the forearm, supplying majority of the anterior forearm muscles and some of our hand muscles. So here we could draw and understand the brachial plexus. This is extra, but I'll just run through it. Here we have our roots, which are C5 through T1. We see C5, and this is like an abbreviated version, right? We're not going to go through all of the details, but C5 through C7 will create our lateral cord. Then we have C5 all the way through T1 that'll create our posterior cord, and only C8 and T1 that will create our medial cord. And so that posterior cord continues to create the radial nerve. The lateral cord has this lateral root of the median nerve, and the medial cord has a medial root of the median nerve that come together and create the median nerve. Now, extending off of these cords, we have separate nerves as well. Here on the lateral cord, we have our musculocutaneous nerve, and then off of the medial cord, we have the ulnar nerve. So when we are in the anatomy lab, we can see a little M that gets created, and that's what we're going to look for in order to orientate ourselves. Now moving on to the lumbar and sacral plexi. We can separate these out. So the lumbar plexus does have a ventral rami of L1 to L4, whereas the sacral plexus has a ventral rami sharing L4 all the way down to S4. And this is usually considered as the lumbosacral plexus together because they have a close relationship. But the four major nerves that we want to know is going to be the obturator nerve, which you see coming off right over here from L2 down to L4, our femoral nerve, also from L2 to L4, and then our tibial nerve, which is going to be further down the line, right along in here. And then we have our common fibular, or it's also called our peroneal nerve. And together, the common fibular and tibial will create the sciatic nerve. So let's concentrate on that lumbar plexus first. Okay, so let's go back. This is going to be the lumbar plexus up along in here, but this is a more simplified image that we see. And this again will come from L1 to L4 and will innervate our thigh, abdominal wall, and the psoas muscle. The major nerve here is our femoral nerve, and that innervates our quadriceps and the skin of the anterior thigh and the medial surface of the leg. And then in blue here, we could see our obturator nerve, which also comes from L2 to L4, just like femoral nerve. And this is going to pass through that opening in the os coxa known as the obturator foramen to innervate our adductor muscles in the medial thigh. Then we've got our sacral plexus, which is going to arise from L4 all the way down to S4, and it'll serve to supply the buttock area, the rest of our lower limb and pelvic structures, and the perineum. Now we've talked about the sciatic nerve just a little bit, how it's made up of the common fibular nerve and tibial nerve. It is our longest and thickest nerve of the body and will innervate the hamstring muscles, which we find on the posterior thigh, adductor magnus, and most of the muscles in our leg and foot. So this is a nice little view if we were to slice through the sciatic nerve and look at a cross-section of it, because it is made up of the tibial nerve and the common peroneal nerve, and it's surrounded by this purple common epineurium connective tissue that holds them together in the thigh. So that sciatic nerve will continue. I know it says tibial here, but really it's our sciatic nerve, which bundles the tibial nerve and common peroneal, and it'll extend down the posterior thigh. And then in the popliteal fossa is where we are going to actually see the division of that tibial nerve and the common fibular. So tibial will just continue on posteriorly. That's what's really pictured here because that's what the nerve that we're talking about. But later we might see an image where we see the common fibular kind of kicking out laterally here. So it's sciatic up in here and then becomes tibial as we move down the posterior leg, and then once we get to the ankle region, we'll see a bifurcation of the tibial nerve into a medial plantar nerve and a lateral plantar nerve that'll continue to supply the foot. And you can see it gives some cutaneous innervation here in the posterior leg and just a bit of the anterior foot. Now for that common fibular. So as we said, common fibular is a part of the sciatic nerve that is extending down the posterior thigh. And then once we get to the popliteal fossa, that sciatic nerve bifurcates and we have that common fibular nerve set free. It is then going to wrap around the head of the fibula and bifurcate into a deep fibular nerve that'll supply the anterior leg muscles and a superficial fibular nerve that'll go and supply the lateral leg muscles. And you could see that it also has cutaneous supply here in the lateral aspect of the leg and anterior leg. Lastly is our coccygeal plexus. This comes from S5 and sometimes a little bit of S4, and this is going to be called our coccygeal nerve. It'll help supply the muscles of our pelvic floor and give sensory information from the skin over the coccyx. And now just a little bit on the aging of the nervous system. Some people do suffer from anosmia, which is a loss of the sense of smell. In adults, this can happen when our olfactory nerve is severed due to blunt force or trauma to the head. Our olfactory nerves only have a lifespan of 1 to 4 months, but as we age, we lose the ability to replace those nerves. So once you lose it, that's it. And odor is going to play a part in taste. So as food is chewed, we see molecules are released and move up through our pharynx and into the posterior nasal cavity. And so if we have a loss of smell, then we tend to lose our enjoyment of food. So we do things like add more salt that can give more flavor, and then that can give us an increase in salt intake that could lead to cardiovascular problems and increase our blood pressure. So that is it for chapter 13. Please let me know if you have any questions.